Morning, everybody.
Muy buenos días, muy buenas tardes a todos y todas.
Good morning, everybody.
Este serie de webinars
We're in
22,
this series of webinars,
Salud y
22-23,
Justicia
Equality
Social
in Healthcare and Social Justice in the Americas, particularly on the second
de la información,
webinar, RAES of
experiencias de
PAHO,
discriminación
the
y
opening to
reducir
intervention experiences to reduce inequalities in healthcare from the local, domestic, and regional.
Mi nombre es Ingrid Gómez, yo soy
I am Ingrid Gomez. I am a professor in the
profesora
Costa Rica University and researcher in the Americas Network for Healthcare Equality. And for us, it is a pleasure to welcome you all to this event we've expected with a lot of passion and dedication, and with our guests today. So this is our second webinar from a series with this title, with the equality of healthcare and social justice in the Americas. And you'll remember that the first one was giving us like the framework of the healthcare situation during this post-pandemic moment. And we now went to this space where we have invited people of a very high level with very interesting experiences in the local, regional, and the national about these equality experiences in healthcare and social justice in every level. So from those presentations, we'll have a moment of conversation and reflection and a time where you'll be able to ask all your questions and participate in this conversation. Every participant will have 15 minutes for presentation and then that very interesting space. We now go to Dr. Sebastián Garcia, who is the Director of Evidence and Intelligence for Action in Healthcare from PAHO. Welcome, Doctor. The floor is yours. Thank you, Ingrid, and everybody. Thank you for being with us during this webinar, which is our second of a series that intends to provide spaces, not only in setting of ideas, but also a conversation toward construction of a shared understanding in our region about healthcare equality and what it becomes key to move on an agenda that helps us close gaps and leave no one behind as we go on in the construction of healthcare systems that become more resilient as a core element during this post-pandemic phase where we're at. And of course, moving on toward the sustainable development and the goals that have been set for those sustainable goals. Development and this pathway that helps us respond to the needs of healthcare development of our people in our region. I want to thank our panelists in this second seminar. The topic is not easy. It implies to work from the theoretical points to their application and the local settings and this heterogeneous reality we many times face in our region, that it also implies to talk about how we apply these understanding, this shared understanding, to respond to the actual needs of people. And so I want to thank very much Dr. Yamir Hurtado, who is the ex-mayor in Paipa in Boyacá, Colombia, and also Dr. Vivian Camacho, who is the National Director of Traditional Medicine in Bolivia, and Rodiel Solar from the same organization in PAHO. And as Ingrid said, these three complementary visions from the local, in the case of PAIPA, and the presentation of Yamil Hurtado, and the national, as it is this understanding of realities that are very much related and that are also very heterogeneous in the countries that have to do with the ancestral intercultural medicine and the healthcare status and the regional setting that implies an understanding in a more macro level. And it is going to tell us about this redesigning of programs and the learnings from the practice for the integration of equality and social determinants in healthcare programs. With that gratitude, I also want to send greetings to Dr. Carissa Tien, who is certainly very committed to this particular topic, who's asked us not to only bring around this series of webinars, but to create a participation network with actors from our region, that it also allows us to celebrate this encounter we have today with the network of equality and healthcare in the Americas. And I also want to greet and thank very much Rodiel Solar, the president of RAES, who couldn't be with us today, but that certainly keeps a very active collaboration schedule. It keeps us constantly connected and working constantly together. So want to thank RAES and Dr. Science in particular, and well, all of you who are adding to this and participating to this. And so I'd like this to be a mutual conversation, that we can talk about this and get together as a group that is not only discussing and bringing about initiatives, but is also showing and seeing the local settings to be able to change the lives and improve the health of many. So once again, thank you all. Ingrid, I give you back the mic, and I just would like to remind you, Ingrid, if possible, that we have simultaneous interpretation available through the platform, and everybody has an icon at the bottom that looks like a globe that says interpretation, and that gives you all access to English and Spanish. Thank you and welcome. So thank you very much, Doctor, and thank you for that warm welcome. So we have Yamir Hurtado, our first panelist. Welcome, Doctor, to this very important event. As the first panelist, and let us remember that he is an ex-mayor of Paipa, Boyacá, Colombia, and he's a specialist in hospital management, healthcare audit, and social security management, leadership and entrepreneurship and innovation. And during the first year of the pandemic, he was a department manager for the approach to COVID-19 and a healthcare secretary, and was also the mayor of Paipa, Boyacá, where he started with the social tissue network, where he won the award of sustainable development and development out of poverty given by Colombia Leader. He is currently working as a manager of the San Rafael Hospital in Boyacá, Colombia. The warmest welcome, Dr. Yami, reminding you that you have 15 minutes for your presentation. Welcome and go ahead. Well, thank you very much, Dr. Mujica, and all of you, and Bajo for the invitation as well. And well, certainly these are very important spaces with successful experiences that maybe even amidst the struggle of the local governments to have operative lines that can implement in the territory and to bring the theory to the practice and make it easier for the general population to have and generated a massive control over this that can generate real social impact that can certainly improve the quality of life of our population. So on that matter, just give me 1 minute. Can you see my screen? Members of the panel? Yes, we can see it. Okay, so this is a project that we generated, and in general, we called it human, the network of social tissue, because it was to bring down the social health and public health care theories, to bring the complex to the particular and generating very simple and practical guidelines for it. The principles of the model that in certain occasions friends from Bajo, Dr. Mexica, have helped us develop this kind of work. And the first concept is when we work with family, first the infancy, with caregivers, moms and dads who had that job. Senior citizens was something we manage with the children and the grandkids, always with the social. Your presentation, if you could click on the top in visualization settings, so we don't have to see that small little slide on the side on top. Give me 1 minute. On the Zoom screen.
A ver, ¿dónde la tenemos por acá? Presentación será acá. Discúlpame.
No, más arriba, en la parte superior de lo que usted está viendo en su monitor.
Sí, señor.
Dice configuración. Dice, lo primero dice mostrar barra de tareas, ese no. El del medio dice configuración de visualización. Arriba de la presentación, digamos.
No lo localizó acá.
They're trying to fix the visualization of the screen.
Configuración.
Es un menú fuera de su presentación. Ahí, el de al lado. Ahí dice mostrar barra de tareas, a un lado dice configuración. Ese no, el de al lado.
Discúlpame que estamos estrenando equipo.
A un lado de ese en donde está, debe decir otro que dice configuración de visualización.
Discúlpame,
Bueno,
ya.
no, pero bueno, no se preocupe. Adelante, doctor. Lo vemos más chiquito, pero bueno, no hay problema. No. Adelante, doctor.
Bueno, me disculpan, de pronto ya verificamos acá cómo lo podemos trabajar. Bueno, entonces en este entorno nosotros vimos el fortalecimiento de la familia, lo que te digo, cuando primero.
So with that, we saw the strengthening of the family. And as I said, with first infancy, we worked with caregivers, and with seniors, we worked with family, children, grandkids, people with a certain disability. We worked with the family, so those who take care of them. Teenagers, we work with parents or people they live with, uncles, grandparents. And these are topics that are important because when you focus on the objective person, maybe we don't achieve as very good of results as we would like, because the setting is important to consider for people in their territory, for them to partake from activities and decisions so that they don't only celebrate successes, but they can also share the failures. Sometimes things don't work at perfection and we need to adjust them to get them into a line for the needed adjustment for public policies in each territory. Information systems that are very precise, very accurate, with monitoring that helps us follow up and have precise information, a good epidemiological profile for the proper decisions, and then the constant communication between the government and every community, every territory, every neighbor, every village, and even every block that helps us monitor the actions if we were working on them well, if we needed to adjust them, if we were successful. And week after week, we had to gather the issues and everything we did during those 4 years that helped us have an experience that is today the source of our information.
Aquí les quiero mostrar a ustedes un sistema de información
I
que
want to
nosotros
show you guys here an information system that we work with, very accurate, and it's house by house, household by household. We work with Google Maps, and with that we identify the components of each household, and we upload them to the system. Every little point you see, the greenhouse is a normal house. If you see lines, like what was the house itself structured as, what were the walls like, people with a disability that we had identified that were not covered by the local government, if they were close to the roads, what was the condition of their bathrooms, what was their setting, if they cooked with wood or natural gas, and other items that we considered in the information. And PAIPA oftentimes had agricultural issues and mining issues that we needed to classify by household, by village, by neighbor, by block. It was generating them very accurate information, very specific information that helped us create specific lines, and we were able to screen almost 20,000 houses in the suburban area. We also had issues with the utilities and topics that were broad to be able to tackle into. In the suburban areas, we had criminal issues, we had bars, we had gangs, structural issues there. We had house by house in this particular map. We had wheelchair icons where we could find disabled population. You'd see the glass of cocktail, that was the areas where we'd find a lot of alcohol consumption and stuff like that. And all this information helped us, this modeling helped us to be able to map the whole municipality, and we were able to arrive to important areas. Here we see a video, and we were able to work with the groups.
Vínculos humanos que conectan nuestras emociones y mejoran nuestra calidad de vida. There is no very good sound for the video. People like so we go to those who really need our help. We walk to places where no one else has gotten. We do not care about the distance or the effort. We just have to give a hand to whoever needs it. Es un texto de amor por nuestra comunidad. Es entender que no estamos solos y que juntos podemos superar cualquier dificultad. Por eso, levantamos. Together we can overcome every situation. We're not alone. That's the message we want to bring. We first listen to their stories, to their life stories, to their expectations. They give us information, and this helps us we are humano.
So with these two videos, what I want to show you is that we built this team that would gather the information. The technicians went household by household in each neighborhood to see the details, the status of the house, if they had social security, what the family was formed by, if they were mother and children, mother, father, and children. We seldom found families, different families in a single household. And we looked at all the cycle, if we had pregnant girls, if we had children, if there were older children that were adolescent with initiating a sexual life, and if they had protection, the girls, if they had cytology or breast examinations, all this heart surveillance in the program, x-rays and everything. And at the and then we would find what kind of illnesses these people would get, who would die from an illness, and we would verify if we had intrafamily violence and how it was. And this, we designed it for PAIPA, exclusively for PAIPA, because each place has their own needs because of the geography or their modus vivendi. And we had an agricultural sector, tourist sector, urban sector, and we had to collect all the information in order to have a clear map that was real according to the reality of the place. And we had to look at the behavior from one neighborhood to the other, or a village that is dedicated to mining is different from an agricultural village. And we were able to be very precise on the information we collected, and we were able to make great decisions and adequate decisions. We charged the information in Google Maps, and we listed the risks of every house, and we would separate by groups. This information would allow us to have adequate action. We polled about 9,000 families, and we looked into this each issue, and we began working with the community to develop action routes with the government, the people, and the authorities. So we were able to make a work route with infrastructure policies and economic policies and many other important issues. And we began within the community, we began identifying natural leaders that would help us look into the community, and they would bring us clear information, very clear information. And every month we would meet with them, and the secretaries of the office would be like the godfathers of each neighborhood or each group. So we would go and see the actions that would be implemented together with the people who would help us surveil the places. If it was health actions or other, and we would collect all the new problems that we would have to solve once we could analyze the information and develop the new actions that would have to be taken into consideration. And also this would depend on the hospital and the mayor's office in PAIPA. So this is the people from the community who communicate with the mayor's office. They would have these green vests, and in this way we would identify every corner in PAIPA and villages 2 hours away from the town, and we were able to get to those houses even if they were further out, and we would identify problems for extreme poverty and solve problems one by one. Here we integrated the mayor's office and the problems of a community are different from the other. Some had problems with a hospital. We had new pregnant girls. We would have elderly with difficulties, also public services, houses who had no water, running water, who would have to bring it from the adjacent rivers. Others didn't have water tanks in order to store it properly. Water service, some would only get water once a week, and they had difficulties storing the water. And these are some of the solutions that we were able to bring to them. Also culture, sports, we got to every neighborhood, every village to give the power to the community so that we could make the solutions through the leaders of the community. And this would give them really a leadership, not only to implement our policies, but also to bring the community so that they could follow these working parameters in an adequate way. We had kids who were not going to school, and we were able to get them back to school, and we identified, and this was made by the possibility of getting into the house with our team. We began lowering the indexes of family violence because of the solution of these issues. Gathering all this information, we could see that there were problems of alcoholism, and we began making decisions in order to, for example, not permitting the sale of alcohol in the morning hours, so people would stop drinking at those times and wouldn't have these hangover and alcohol excess that would bring them to fighting and to leading violence. And we would also help those who sell liquor to recognize when not to sell more alcohol to a person who is already drunk. Doctor, you have only 2 minutes left. Oh, I'm afraid the sound is not very clear. We have to go in situ. We have been able to improve the life quality of the members of the community. And it's important to work together with all the members of the municipality to bring them public services and to improve their habits. My name is Andres Camargo. I'm from Paipa, and I'm creating a healthy community. You can see the work of this person with the community. We were able to encourage our workers to have access to the community and to help and implement. We were able to improve the water services for a lot of families in Paipa, and we were able to provide this service also with the garbage. We could generate products that we could sell to the community, or we could also give them the tank with connection to the kitchen, to the laundry, and to the bathrooms. And something very important is the land property. We also developed a policy for sidewalks, streets, and sports places, and generating all these touristic activities. And we were able to help a lot of entrepreneurs to develop their activities. I don't know if it's possible to watch these two videos that will also give you the possibility. Maybe we'll stop here and we will have some time at the end for dialogue. So we will continue with this important experience. Now, with the agenda, we're going to give the floor to the next panelist. And after that, we will be able to come back to you. So we give the floor to Dr. Vivian Camacho for her intervention, Intercultural for Ancestral Medicine in Bolivia. Dr. Vivian Camacho, Director of Traditional Medicine. She is also in the Vice Ministry for Ancestral Medicine in the plurinational state of Bolivia. She has been 40 years in the Pan American Health Organization, coordinator of village health in Bolivia and for the Andean region in Latin America within the World Movement for Health. Also ancestral midwife and for endogenous development in Latin America, also with peasant communities, promoter of ancestral knowledge. So we welcome Dr. Vivian Camacho. You have 15 minutes for your presentation.
Vamos a inaugurar la Cumbre Nacional de Gobiernos Autónomo Indígena Originario y Campesinos aquí en Bolivia. Se ha retrasado un poquito, mil disculpas.
So it's been taking a little, I'm so sorry, but I'm doing the best I can to be able to participate. My greetings to all the authorities here with us, our friends in Bajo that have called us to participate with you. Local language. Greetings from Bolivia. So if you can help me share my presentation. So while you work with that, with the form that I have been suggested with, I'm going to be talking right now, we're right now in Bolivia as the General Director of Traditional Medicine. We're going to share with you our breakthroughs and challenges within our communities. And also in the presentation I've prepared, I'd like to show you what we've moved on with the law and the proposals our people have had.
Sí, doctora, en un momento estamos
Yes,
entonces.
doctor, in a minute, we'll be working with the presentation. Those in charge. So give us a minute. If you can guys help us with the video.
Doctora, nos consultan las intérpretes que si puede reducir un poco la velocidad a la hora que conversa para poder hacer.
She's being asked to reduce the speed that she speaks with so that we can translate for her, the doctor from Bolivia, because she speaks too fast. Okay, so while they connect, I want to tell you that here in Bolivia, we moved a lot in the plurinational government. We have the intercultural recognition. We have Law 459 from Ancestral Medicine that recognizes the wisdom of our communities and everybody that practice traditional medicine with the various specialties. Now I see the presentation, which is spiritual guides. And so the next, We also have the midwife practice and traditional doctors.
Siguiente, por favor.
Next slide, please.
Como estamos en este evento, justamente,
Since we're in this event, I gotta tell you, health is a human right, not a cargo, not a good only. It's not a merchandise. We want to say that health is eating well. That is also a human right. Oftentimes in the COVID-19, we were able to find and see the evidence that people not only didn't have a good access to health care, but the pandemic of the indifference has been out there forever. And we talk about social justice for our people. And to think what kind of healthcare is it that we're looking into. We've learned about one single culture that has been about the homicide and the load and the looting, and we need to think where healthcare is being conceived from. For us, our Andean cosmovision is alive. We still have our holy places, our ancestors in our territory. We are Koya Suyu, which means herb or medicine, and Suyu means people, and these are the healers, and Tawantin Suyu, meaning the four people, where Koya Suyu is recognized in our political constitution and the plurinational state of Bolivia. Our ancestral ceremonies bring us harmony and balance. It is our ancestral medicine what we think about as cultural resistance. It reminds us that it's physical, mental, and spiritual because it protects the sacred territories, the plants, the animals, and human communities. We need to remember we're alive people with our own culture and know how to protect life. And this has to also do with the agricultural ritual calendar, cycle of life, death, the recollection of food, the plant and harvest, the cycles of sun and moon, all of it connected and related and a part of our ancestry. We need to keep on building this interculture from an indigenous view that complements with the Occidental view and all against the hegemonic, thinking about the magic and medicine combination is the context in the culture of our nation, the link with the Mother Earth. And to ask ourselves again, what do we want to look like? Aren't we showing that we can live in a different way, eat in a different way, feel in a different way, rejoice, get dressed, heal in another way? That's why we need to question Western hegemonic medicine, dominant Western medicine that we've learned, and we need to be able to resist that. We also need to look into marketing of life. Medicine has come about that global marketing of life, and we need to strengthen the conversation of know-hows between our traditional ancestral medicine, conventional medicine as well, but always thinking that without social justice, there's no medicine for anybody. But we're also talking about epistemological health. This is the justice that recognizes the know-how of our people. We need for the academia to stop rejecting our people and underestimating and excluding it. That's also why we advocate for the diversity of thinking, the diversity of our people that makes us grow, that strengthens us, that protects biodiversity. So we advocate for the solidarity understanding of those of our people who are fighting against. We are a majority farmer indigenous people. To talk of Sumac-Kaisai, we need to remember that the earth is not ours. We belong to it. The conversation of know-hows between both medicines and strengthen the decolonization efforts so that we can remember that we as women have been great carers of our territory. So we also need to get away from the patriarchal model. Law 459 in Bolivia, it defends our traditional ancestral medicine, the national healthcare policy that considers the culture, the family, the intercultures. Before the coup we had in November 2019, we'd been the only country in the Americas having the vice ministry of ancestral vice ministry. And with the coup, this ministry was hurt. But from where we are, we're promoting these policies, advocating for it with the participation of everybody. In terms of COVID-19, it has been evident for all of us in our territory, upon the abandonment of many governments and the institutional collapse. We've responded with a traditional ancestral medicine in our territories, showing that our medicine is of high efficacy and effectiveness and very low cost. To these documents, the policies of PAHO, and even the very statement of Almataya are calling the governments to work with traditional medicine. As a High Commissioner of the Americas, we've worked with this document with the recommendation of the high level of the 40 years of Almat. Here we have our picture of the head of Michelle Bachelet and vice ministers of the region of the Americas. We have gotten a lot of advance in healthcare for the people. We've also put together this document thinking that we also need to promote this conversation of know-how, and we need to strengthen the interculturality in healthcare within the systems in the universal public and free systems of our territories. I'm sorry that I sound like this, but she's running. Within the responses we put together in the regional platform on COVID-19, we put together these documents that I'll leave here with you with good practices from our communities and a very good case in the jungle and the Matico command. But in many of our communities, we have these cases and how our people have organized and put together to go house by house and first line with the traditional medicine to put together their efforts so that the population can strengthen their healthcare and lower the mortality index in regards to COVID-19 at this later time. But historically, they've always been taking care in our communities with traditional ancestral medicine. To us, community strategies we've been strengthening during this time to be able to approach comprehensively the determination towards social justice, integrality, and the respect to the differences. One of the most important have been the strategies of indigenous communication with our communication means that have translated to our languages what is happening and where the constant reflection is being done for community healthcare, also strengthening the solidarity within communities that have taken care of one another during COVID when the communities were locked up and people were locked up in the cities and the farmer communities have abandoned tons of food and they were working with this to feed the cities. And so we need to strengthen this. We need to show that we're this change that we are and with the know-how and the dignifying life of our people that it's been possible because of the solidarity, reciprocity, the good values of our indigenous communities. Next, please. It's really running. I'm sorry. Some important recommendations are to continue exchanging these strategies because we're not going to have a recipe to say this is what it's done with this country, this is what it's done over there. Every territory decides according to their circumstances, their setting, to their social context, political, historical, economical. So to keep talking between us, a South-South collaboration to face the philanthropic capitalism and because they keep thinking that the global South is still their backyard. So we need to be strong to show the answers and the responses that we have to our communities to revalue and dignify the farmers' lives, and particularly the organization and the popular power for an effective health and the territory for the organized communities to defend their rights, because that's where they construct healthcare from. I am a member of the traditional committee, traditional medicine territories. We have our site with the municipalities and areas for researchers to make it visual. This integrative medicine and ancestral medicine needs to have a holistic approach. I'm also a member of the global movement of the people who are always trying to advocate that this is our human right and not a merchandise. And this song, health is dignity, health is life, without injustice, without humiliation, our own thinking, our heart, our community free and joined and together with the Mexican communities as well. And the fight for the land and the territory, and all of that is constructing the construction of health. We're also members with the University of Brazil. We're working with these proposals for many years.
Consulta, nos dicen las traductoras que tenemos problemas por la velocidad con la cual conversa, entonces que si podría hacerlo un poco más despacio para poder ajustar la traducción. Muchas gracias.
Mil disculpas. Y ya, esta es mi última lámina y tengo que retirarme porque
This is my last and I have to leave because I have to open this event. For us, our Pachamama is our main healer. It's thanks to her that we have food and coverage. It is thanks to her that we are able to move. We have come out of its womb and we're going back to its womb. That's why we talk about ecosystems, health, the health of Mother Earth. And so with that reflection, I also leave you this civilization crisis that we are facing, that it has to show where are we going to get answers from? And many of those answers are alive in our territories with the wise people in them. Thank you very much. And now I have to leave because I am in this event. Today, I wasn't supposed to be in Santa Cruz, but I had to come and open this event with the Ministry of the President. We have the authorities of the autonomous regions in Bolivia, so that we can also support these intercultural and health policies. We have many of our people walking around for this event. It is a reminder that we need to listen to our people, and from our communities, we have to work together. So my apologies, but I do have to leave now. I thank you for your invitation, time and space.
Muchos éxitos con la actividad también.
Great success in your activities as well. We continue then with Dr. Rodiel Solar. She will not be able to accompany us. She has something pending. I see her connected. Still, I don't know if you can hear us, Doctor. Yes, we can't hear. Your microphone is closed. Okay, yes, I apologize. I'm afraid I have a problem with the agenda. I have to apologize. I think there is many things we could discuss with this in the local scope and national scope, but I would engage myself in another moment to show you the national perspective and to share the presentation that I had for this meeting. I apologize again, and I wouldn't just like to present and leave without listening to the comments and opinions. So for this reason is why I decided to leave before making the presentation. Thank you, Dr. Solar, and we really expect to be able to organize another event where we will count with your participation and your experiences at regional level that contribute to this interesting dialogue. We are then going to bring this, to open the floor for dialogue with what Dr. Vivian Camacho was explaining to us and to what Dr. Solar said. Do we have any comments on the chat? And we invite you to write down your comments on the chat. We have from Dr. Hurtado, we have several comments. Nieves is saying thank you very much to Dr. Hurtado. What a great initiative. And I wanted to ask if you have any publication or evidence on the results, or how do you plan to show these results? How do you show these measurements for empowerment and other things? So we invite Dr. Hurtado to tell us about this. Thank you very much. Yes, this experience we were able with Oscar Mujica from Washington. He was helping us calculate tiny inequalities in communities, and we issued a publication that we can share at any moment with you with base and numbers that really show some important lines. And it's of course a beginning so that these type of numbers can be modified, and it can give us some document or a strategy that can be replicated in other local governments. This publication, I can share it at any moment so that you can probably give it to the participants here in this panel. And where with Dr. we could see the type of work that we can do. And I give you an important comment. Sometimes publications and theses for doctorates or masters concentrate on what, and the real difficulty is on how. And this thesis should go down to the ground and really tell us how to use it and use it better for improving the quality of life of our communities. We have a publication, we're going to share it with you, and we expect in the future to have other instruments and methodologies that will allow us, will allow anyone to just take it and develop it in other municipalities or places. And here is where we share idiosyncrasy and many other aspects. Thank you, Dr. Hurtado. And we will be happy to share this material and to bring it and make it available to all the people who are interested in looking at it. Your intervention and Dr. Vivian Camacho, who was telling us about a local experience and a national experience from Vivian Camacho, and some important aspects that we would like to underline. You were telling us from your experience several principles or pillars that we could understand within a model of attention that will foster health and education in this fortifying of the families with the empowerment of the families and the reinforcing of all these actions and the permanent communication in this experience within this context, this going household by household, visiting the families and for the members of the community, and the identification of natural leaders, this intersectionality that you are really experiencing in the community, and the health in all this framework. And this goes from the theory to the action. And we would be very interested in knowing, Dr. Hurtado, how we can make this experience to maintain it in time, how to make it sustainable, how to keep these advances, how to maintain this level of cooperation and give it a follow-up and improve and look at the results in each one of the stages of the action. Here we would have to have 2 points of view. One, the people who participate in the strategy, what I was telling you, at least the workers in the mayor's office, those who work there, and the others to be able to bring them from the office and generate this accompanying, and they were able to leave it, to leave the community. They would have to go into the house and see, and some of these office workers would tell us that there was a leak on the bed, and they found mattresses on the floor where there was no real floor, but just earth. We found products, food that was rotting because they did not prepare it. So we really made these employees to see and to fall in love with the community. And it's not only to bring help, but also to help people solve these problems. To work in these teams gave great results. For example, working on a road in front of their houses, they would have to help with the work. They needed to work on that, and they will take great care of it because they are going to really be concerned about maintaining these works and repairing it whenever they need. And this is important for the community, and these works were very important to give training to the people. For example, if we need to clean riverbanks or many other places, and as a community they really learned how to do that, how to do all the maintenance, and empower the community and empower the employees of the mayor's office is going to give results, even if the mayor's office in charge at that moment are not developing this. And also this is going to have a continuity. The most difficult is the continuity of the change of office, because each government, each office wants to be different from the previous one, or they want to do different things. And sometimes they do not continue with the public policies, for example, those that are approved already, that could be through the municipal councils or the municipal assemblies, senators or congressmen. They could generate these and make them government policies. This is difficult because the governments change, and we would have to create a consensus within governments so that they would respect this situation. But the best tool that we have developed is empowering the community itself and the employees who have to leave these actions with the community. And if these policies, the community are going to continue developing them, even if they don't come from the government, they will come from themselves. And this is going to help the governments continue with the development of these actions, and this is going to help many municipalities. Two very important themes, that would be empowerment of the communities and the employees of the mayor's office. These two aspects are very important. In the chat, we have an intervention of Osvaldo Medina, who would like to know which were the challenges and barriers in this intersectional work. Here we show you the good things, the pretty things, the results, but many other things couldn't be made, couldn't be developed, because sometimes it's very difficult for the community to really understand it. We had to bring a common point in order to bring some solidity to the community and to generate external lines for communitary benefits. I'm going to give you an example. Here, Colombia is a very Catholic community. We have the Virgin Mary, Jesus Christ, in all the Catholic practices, we see these. So in rural areas, everyone wanted to build churches and for the villages. When we saw this opportunity, maybe with giving them materials for this building, they would accept us better as governors. and this would create a collective work. We tried to promote many of these activities so that they could do them themselves, even if it was not from the government. They would like to have their own churches and the infrastructure that they all would be brought together. So the women would help with the cement, men would place bricks and the roof, and when they were able to see that these kind of things we would give support to, then they would be more willing to develop other activities, for example, aqueduct or potable drinking water and many other things that, and this correlation was important. The most difficult is to have the information as it is. Sometimes they don't give you the real facts. Sometimes we really had to identify the attitude, maybe a twitch of their faces, or when the husband would look at the wife in a certain way, we had to generate trust so that they could give us the real story. And it's important to build this communication because we can have the real information. Then we can, at that moment, we can promote solutions. And what they needed was a government that would give them real a trust atmosphere where they could develop all the solutions and where they could really work on the needs of the community. Communication is key, is very important. We have to insist. It didn't work, you insist, and perseverance so that you can develop and massify and have many results. We failed on many things because sometimes people would close their doors. Maybe they were scared that even they would be scared that if the kid was not going to school, they would be punished for that because the kid was working instead of going to school. And all these fears, we had to work on all these fears, and we needed a permanent presence in the community. And this creates correlation. And this is the problem of construction. It's not repression, it's not punishing, but we have to build a construction line that is going to make them develop and give a solution to the problems. Because we do not have to work with violence, for example. We do not get there to judge, but we have to listen to them, and we have to introduce in their mind which could be the problems that are going to develop in social work, in solutions for domestic violence.
So it wasn't working and do strategies, but the greatest problem here was to actually go and create that trust with the community, to have them feel supported by us and us feeling supported by them, and having the information as it is, with consolidating of topics that maybe were not concerning us, but then that way they felt supported, and then with the job that was relevant to us, they could feel that they had already been given support by us. I don't know if it was understood, or maybe my response was a little bit twisted. No, very interesting and very acute what you said about generating the trust and the community as a key point to be able to have that good exchange of information and consolidating the work you've been developing. And about to end this conversation on this experience you've shared with us, we also wanted to ask, what is the role of international cooperation from multilateral organisms and multilateral bodies in the implementation of these strategies to reduce inequalities in the region? How do we integrate? How do we take this work together with the international cooperation? How the multilateral entities are put together in these kinds of initiatives? There are various ways to work. We had a very broad cooperation in PAIPA, starting with PAHO and WHO topics. With their tangible mathematical methodological knowledge is that we could give them support in establishing these data line to bring them down into practical methodological knowledge so that this could be replicated, which is the most important part. Cooperation is oftentimes not just about donating money. We use a lot of training and exchange. So besides WHO, they worked with people from PAIPA, they took them to Peru. I was taken to Washington and Ecuador. So why? Because we had to explain what we were doing, but also seeing other experiences and see what could we learn and adjust it to our own needs here in PAIPA. So it's a very important topic. For instance, midwives from a municipality in Brazil. I remember the strategy was published by CEPAL. It was called the 4 leaves flower, and it was the government of CEPAL in Pajo that decided to train women midwives so that they could be in a constant surveillance there in this 4-leaf clover flower projects, so that in any kind of complication, they could find what it was all about and help it reduce, which actually reduced almost a 70% maternal mortality. And this helped us be constantly there with the community in situ. And that helped us be able to spot things on an early stage when we were not able to do in the past. So we were able to send about 20 professors and teachers from schools in PAIPA to Israel to be trained in education and how to approach different education matters. We also sent some of our representatives to China so that they could learn strategic planning, legislation, the commercialization of products. We have a queso PAIPA cheese, and the exchange in China here in PAIPA. That was something that we were trying to adjust to our need, which is key for us, because when you make contact with other successful experiences you haven't seen, this is something you can replicate. And it was something that PAHO brought, and I want to congratulate PAHO for that, is that they gather all successful experiences where they have any sort of influence also with the WHO, so that we could have this data bank and go to these experiences and have knowledge exchange with these other countries that can help you bring them down to your place. And also something Dr. Oscar Mojica did with us was they helped us with these methodologies where we had the data, where we had the input that helped us with that wonderful guidance that was wonderful, and they were able to help us create all these methodological pathways. And so I want to thank Dr. Mojica for that, because that helped us generate a greater impact within our community in a very practical way. Because what we did was so very simple, so that if anybody didn't have preparation or had no studies, they could know how to do it, because this was very important to be able to generate instruments that wouldn't only allow us to generate good lines to our community, but for them to be replicated into other municipalities and apply them as we did with others. And I think that come and go with the information consolidation of experiences and the experiences of those that work with them to be able to clarify those doubts. And that has also been wonderful, because that's how we generate operative lines with clear instruments that help anybody access to them at any time. So thank you very much for that experience you've narrated to us in a very open way that helps us in so many other contexts and share this experience. They congratulate you from the chat for your achievements in the municipality, and we are all agreeing here in the very successful experience you've told us about, and we want to thank you for your participation. Here in the chat, we also have a comment about the intervention of Dr. Vivian Camacho,
presentación y además
congratulating her for her presentation, and they're also telling us that it's very stimulating to see how is the traditional medicine being worked with, always present in the families, and how much work is being done for that. That in many times that has even been the only resource in healthcare when the government many times does not give an answer. How wonderful that the PAHO and RAES are opening to this conversation. The truth is, many of us need to learn and understand that traditional medicine and Western medicine need to be inclusive and complementary. So thank you very much. Thank you, Jimena Avellaneda, for your comment. And to close this presentation, there are some comments regarding Dr. Vivian's presentation, who couldn't be with us during this Q&A session. But there are very important messages sent about healthcare as a human right and not as a merchandise. A very strong message, very deep message that calls us to reflection. The interculturality against the hegemony instead of just one single knowledge in health, but for them to be complementary, that there is a conversation between those two, that there is a decolonization as part of the knowledge in healthcare. Community strategies and integrative medicine as a good strategy that Dr. Camacho also proposes to generate healthcare and to promote it from these contexts. Well, without further ado, we really want to thank you for your participation and give you our invitation for the next webinar that we'll have on October 27 with a satellite participation in the 7th Global Symposium in Research about Healthcare Systems in Bogota, where we'll continue thinking about this. Remember, this is a series of webinars when we had this view in this particular from the regional, local, and national. And October 27 in Bogota, Colombia, we'll have a participation where we'll talk about, from that theoretical perspective, those experiences and learnings that we've had along this path and how to move from that to the action in pro of social justice and equality. From my side, we want to thank you very much, all the panelists for your experiences that are very interesting to share their knowledge and the joint construction of healthcare and the authorities of PAHO, particularly Dr. Mujica and Dr. Sebastián Garcia, Mailen, who've also been with us during these reflections and these conversations, and RAES team as well, that have given us a lot of their help for this event, Wilmer, Luis Fernando, and everything that have made this possible. We want to thank you very much, and particularly all of you for joining us and for sharing with us your questions and experiences in this equality and healthcare and social justice conversation. Thank you. Have a wonderful day. Thank you very much. And we'll have this participations in the social media so that you can revisit these concepts. Have a wonderful afternoon, and thank you very much. Goodbye.
Muchas gracias por todo, muy amable.
Gracias, doctor Hurtado.